A new op-ed says the U.S. could be close to achieving herd immunity against COVID-19. The Washington Post opinion article explores what herd immunity could look like for the nation when we could reach that threshold, and what to look out for while we're still in the middle of this pandemic. John Barry wrote that piece. He is a distinguished scholar at Tulane University School of Public Health and Tropical Medicine. He also wrote the book, The Great Influenza, the story of the deadliest pandemic in history. It's good to have you on. What a fascinating op-ed. Before we even get into it, are we going to have to change the title of that book? Because the number of people who have succumbed to COVID-19 has surpassed the number of people that died in the Great Influenza pandemic, and the number is still sort of climbing.
First, good morning. Second, fortunately, the 1918 pandemic is still the record holder for sure. 50 to 100 million people worldwide, and if you adjust for population, it'd be equal to 225 to 450 million people today. Thank God that we are not facing anything like that, even in the worst case.
That is an important clarification, Mr. Barry. Thank you very much for sharing that. All right, let's get into your op-ed. You say in your piece, 90% of us will have immunity against COVID-19 by Christmas, if not before. So when we talk about herd immunity, does that include, for example, should the virus mutate again? We're already dealing with the Delta variation. Could that mean for future variations as well?
You just raised the key question. Herd immunity with some viruses, like measles, means your protection against measles is essentially perfect. So if a virus keeps trying to find an unlocked door, an unprotected door, it can't find one and goes away, even though there may be some unlocked doors in the neighborhood. This virus is not like that at all. There are breakthrough infections, and there are, as you just mentioned, variants. I think what I was trying to do was to lay out several scenarios of where the virus might go. Immunity, unfortunately, is not one of them, at least certainly not in the near future.
Yeah, in fact, what I find kind of interesting about your op-ed is that you've got the headline, but very quickly as you read kind of the first couple of paragraphs, you call it so-called herd immunity. The herd immunity is real catchy. It gets our eye, gets us to read it, but you're basically arguing herd immunity doesn't apply to a virus like this. As you point out, it applies to, a virus or an illness that once there is a vaccine, we are basically stamping it out. But COVID is probably going to be circulating regardless of the vaccination rate. We just won't end up in the hospital. That's really like your key difference. But, and you lay out all the possible scenarios kind of going forward. Am I nailing it?
Pretty close, yeah. And unfortunately, there will be probably some people who still go to the hospital. But even with the variants, you should have considerable protection. The real kind of interesting point is where this virus is going to go in the future. Right now, it can bind to cells in your upper respiratory tract, which makes it easily transmissible. It can also bind to cells elsewhere in the body, including deep in the lung, which makes it potentially lethal. It's possible that it could lose that ability. There's a theory that an 1889 pandemic that was known as the Russian flu was actually caused by a coronavirus that today causes the common cold and doesn't kill anybody. It is possible that this virus goes in that direction. It's also possible that it goes in a considerable nastier direction and continues to infect and kill people.
So let's talk about that comparison that you make in your op-ed with the pandemic of 1918. You say at least one more wave of COVID-19 could be coming based on how that flu pandemic went. What would that look like? Yeah.
Well, again, as you just mentioned, 1918, you had a first wave that did go worldwide, but it was not nearly as transmissible as the second wave. Second wave went everywhere and was also much more lethal than the first wave, which actually is what's happening in Delta, is more dangerous than earlier versions of the virus. Then everybody was infected. You did get a third wave that infected a lot of people, not as many as the second wave, and it was not as lethal. But by 1921, you were back to ordinary seasonal influenza that it can kill people, but it's nothing that is going to change society. I think that Delta has wiped out all its competition because it is so infectious. It has such a high viral load. But I think once everybody has been exposed to a virus, then the competitive advantage shifts to a virus that's capable of evading the immune system. I think we will probably get a variant that is better at evading the immune system than Delta has been. And that will cause probably another wave, and there could be other waves in the future. But as you said at the very beginning, with everybody having some protection, either from vaccination or because they already have been infected and recovered, the death toll is going to go down, I believe, because you will get some cross protection, and many fewer people will end up hospitalized with severe illness.
So the op-ed is really good because, like you said, you sort of map out all the possible scenarios for COVID. It could sort of change the way it operates in the body and settle in an area of the body where it replicates and can be spread, but can't do sort of lasting damage, doesn't make people very, very sick. Or the Delta variant could be wiped out and other variants could then rise because they don't have the Delta variant and people could start to get sick again. And I encourage people to read the op-ed just because it's very interesting stuff, and I'm not a scientist. But, the current conversation that we're having right now is about whether or not kids should get vaccinated. And, I mean, it's only like about 30% of the parents, at least at this moment, that are really in favor of getting their child between 5 and 10 vaccinated. How important is that in terms of getting a handle on the pandemic from your point of view?
Well, I think it's very important for a couple of reasons. Number one, as one of your previous guests was pointing out, kids can spread it to somebody else, or anybody who's not vaccinated can spread it to someone else. That's number one. The second thing is kids are dying from this. As a percentage of the 700,000, no, it's very small, but kids are dying. If we had a disease out there that was killing hundreds of children and making thousands and maybe tens of thousands of them sick, we would be very excited about it. And we would be very concerned. If somebody said you had a vaccine that can prevent that, then people would jump on it. So if you look at it in that context and not in a percentage that, well, children compared to adults are not getting sick, you look at it differently, and I think parents would be leaping at the possibility of anything that made it possible to protect their kids from dying, from going to the hospital. Kids can get long COVID too. We don't know what the long-term repercussions are from this disease even now, and what it may mean for a kid's future. So absolutely, I think parents should get their kids protected, for the kids' sake and as well as for the sake of the larger society.
John Barry, great talking to you. Really interesting op-ed. Thank you.
Thank you.